A lot of the expectation around car crashes or car accidents come from television. People expect big wrecks, fractures, lots of blood, emergency services rush into a scene. But the majority of the time, it's not so obvious. You don't see those big crashes, you don't have a fracture, and you don't have any obvious injuries. When we say invisible injuries are injuries that do not show up on diagnostic tools. So traditional tools like X-rays, MRIs, ultrasounds don't typically capture these injuries. So for example, a person is in a motor vehicle accident and they maybe have a headache and they present in the hospital. A CT scan is done of their head and they're told, well, there's no bleeding of the brain, there's no hemorrhage, and everything is okay. But typically these individuals will tell you that something is off, something is wrong. Maybe they can't process information the same way. Maybe their word finding skills are a little bit impacted, or maybe they have some dizziness, they're sensitive to light, sensitive to sound. It's also the same with chronic pain. You have, you're in a motor vehicle accident, you start to over time develop pain in your neck, your shoulder, a different part of your body. Maybe you even have difficulty moving your body part, maybe a compromised range of motion type situation. What happens is you find an injured person spend a lot of time trying to convince everyone who would listen that something is wrong, they're in a lot of pain. And then there's the other subset of invisible injuries like psychological impairments. I have a lot of clients who say, I felt fine after an accident, but then I realized next time I got into a vehicle, I was so anxious, I couldn't move, I felt paralyzed. Car crashes are emotionally charged situations where you can't really trust your initial reaction or your initial feeling, because your body at some point is going to quieten down, you're going to be more relaxed, your muscles will try to go back to default status, and then you might start to realize that you're actually hurt. Regardless of how you feel on the scene of a motor vehicle accident, it's not a final position, or it's not a determination of how things will play out. So you should take it really seriously to say, I'm going to follow the advice of the emergency medical personnel who show up on scene, assuming they do. But if they don't, then I'm going to go to my family physician or a walk-in clinic, or just go to a hospital to have myself looked at, just to make sure. I usually liken chronic pain, the feelings and the limitations that come with chronic pain, to how we feel when we go through a really difficult winter. The winter starts out, you get your jacket, you like the snow, you like the ice, and it's okay. If you ski, you get out your gear, and it's all good. But as time goes by, you start to realize that the initial enthusiasm is gone. But that's not the point where you start to relate. It's the random Tuesday, I like to call it, when you get out of the house, you're hit with a whiff of cold, and you decide you are sick and tired of being cold. And that's how it is for people with chronic pain. They start out being optimistic, saying, you know what, I'll beat this. They go for all the treatments, they attend all the scheduled appointments, and they're optimistic. But it's not getting better. The enthusiasm is curbed a little bit, but they go for the pain injections, they go for the physiotherapy, the massage therapy, but they're still in pain. And then one day they realize they are sick and tired of being in pain. Except that on my part or on your part, where you can look forward to the spring or the summer, this is their life. And if that's your reality, I guess it's going to be difficult emotionally for you. Family members, relatives, friends, colleagues who interact with people who have chronic pain, chronic cognitive issues. And that's the point where they start to take it a little seriously, because they start to realize that this person is having a change of personality, and this ordinarily pleasant person becomes really irritable, becomes very withdrawn, and the spark is gone from their eyes, and they don't want to participate in everyday life. And to you looking on the outside, you might say, just pick yourself up and go. Except that's not what you do in the winter when it's super cold. you were sick and tired of it, and you just wanted to go away. And you push through the day, but it doesn't mean that all is well with you. It means the truth is you just want to be done with the winter. And it's the same way. But there's no escape for the person with chronic pain. And that's why it's so serious. And that's why all the things we'll be talking about in terms of initial medical intervention and seeking care and being very aggressive about treatment at the beginning is very important and should not be, you can't overemphasize that type of thing, because chronic pain is, or a long-lasting cognitive and emotional issue is not something that is to be taken lightly. The problem most of the time is that it takes too long to get to that phase. We're talking something that should happen within the first 6 months or 1 year, but most of the time people come to that acceptance, they tick all the boxes in terms of initial investigations 2 years after. It's often said that people overestimate their ability to deal with these symptoms, but they also underestimate what a little medical intervention might do for them in the long term. It is important to seek urgent medical intervention. Try to get your family physician to send you for diagnostic testing, x-rays, MRIs, ultrasounds, CT scans, however the case may be. But also it's important to follow medical advice and aggressively and proactively address the symptoms, whether or not you suffered from a concussion, you have an emotional issue, or you have musculoskeletal pain. And if it turns out that you're in fact suffering from an invisible injury, which cannot be diagnosed with some diagnostic tool, or there's no objective measure to support the fact that you're suffering from these types of injuries, then you have to go to the second level of intervention, which most of the time is seeking specialists' help. Well, there are a lot of pain clinics out here. We work with a lot of them as well that would help clients, patients develop strategies to cope with these injuries. My name is Brumé Jabuoma. I personally believe that the best way to go through life is to do or to act within spaces that are larger than you, or to serve a purpose that is larger than your own private aspiration or goal or purpose. And being a personal injury advocate, which is what I like to call myself, it allows for that, where you see people who would otherwise be just ignored by the system find voice. I help them find their voice. I've helped them find articulate what it is they're going through and try to get them some sense of justice. Here at Pace Law Firm, our focus is on helping clients and injured people navigate this process of urgent medical intervention, especially within the first 6 months after the injury, after the crash, because those are critical to the overall recovery of clients or patients.